Why are you shutting down A&E?
Won't it take longer to get to hospital?
What's the difference between A&E and an urgent care centre?
Shouldn't we be sorting out community health services before hospitals?
We've been particularly active in developing what we call the clinical model, optimising the services to meet the needs of the population. The current situation that we've got is actually very old-fashioned. To actually have 2 A&E departments and attempting to be run 2 independent hospitals in such close proximity is something which is most unusual and is not actually viable to provide a proper service on both sites. The fundamental principle that's being proposed for the hospital changes is to put all of the emergency facilities, all the acute services under the same roof. But those who make their own way to hospital will still be able to go to either of the hospitals to the urgent care centre. That facility will have x-rays, it will have investigations, it will be medically staffed 24/7. The difference will be that ambulances who are picking people up will go to the emergency site. People have worried about the extra time that they will spend travelling in ambulances if the hospital is specialised on one location, but would want to emphasise that the most important time when you're very ill is the time for the ambulance to arrive at you. They very rarely set off immediately with a seriously ill patient. They will spend some time at the scene stabilising and initiating treatment. So an extra time spent in an ambulance when you've already been stabilised is much less hazardous than being taken to the wrong place. I think it's fair to say as well that the ambulance service themselves recognise that they quite often transport people to hospital who don't need to go there because of the lack of community services to hand over to. As people are living longer and as people have multiple long-term conditions, so your heart patient with diabetes and rheumatoid arthritis, they're not well served by a hospital-based model. So a very important part of this vision is to actually reduce the dependence on hospitals, to enhance the quality of care closer to where people live, and maintain people independently living in the community where we're absolutely sure they would prefer to be. That is something which we call care closer to home, and it is already avoiding unnecessary admissions to hospital and maintaining people's independence. It's actually a very significant investment in local services, so it's certainly not a cheap option. It's actually addressing some long overdue modernisation changes that are needed. We understand that the nature of these changes do seem very daunting to the public, and maintaining public confidence in the NHS and confidence that the right services are there available for people is always absolutely uppermost in our thinking. We're really eager for the public to engage with us now in this consultation exercise and to actually help to feed us back their impressions of what's being proposed. They can do this in a variety of ways. They can fill a survey on the website. They can attend one of the open meetings which have taken place in many of the localities around Calderdale and Greater Huddersfield. This is the public's NHS at the end of the day, and we want them to actually understand and help us to plan the changes that are needed.